And we are recording. So tell me who you are and tell me a little about your business.
I'm Don Stull. I own a restaurant in Virginia Beach. I've been in the restaurant business for nearly 40 years.
Mm-hmm.
This is my latest venture. I've been open for 11 months.
Mm-hmm. Tell me about the restaurant. What do you serve?
We are a new American restaurant. We offer a few traditional dishes for the traditional minded, but most other dishes have our little twist to it, our own little trademark feature that is unique.
Mm-hmm. All right. And how many employees do you have?
Right now I have 15.
Cool.
Soon to be 17.
Hiring, that's a good thing. Do you currently offer health insurance for employees?
No.
And why not? What could be done?
Well, primarily, I can't afford it. I'm a new business, so obviously I can't afford it. But secondarily, in my last restaurant that I owned for 18 years, I offered insurance to all of my key employees who had been there for 2 years, and the premiums got to be onerous. It was just outrageous, and in fact, the high premiums were one of the reasons that I sold my business. Now, there's never ever a one reason for any business to be sold, but certainly the prospect of having to cancel insurance and or making my employees pay for it had a lot to do with my decision to sell.
All right, that's too bad. Let me ask, if Governor Bob McDonnell walked in your restaurant, sat down, ordered a cup of coffee, and said, "Don, what should I do about health care?" What would you tell him? What's your advice?
Well, I don't understand why health companies are run for the benefit of the stockholders. It is an anathema to me that we have a monopoly for utilities on power and gas, and they seem to be doing pretty well. Why couldn't the health insurance companies be managed by the state in the same way? We have limited options in this state already for the number of companies, so it's not a free enterprise system in any already. So why can't we control the amount of profit that a company can make, or even go back to some old concepts of healthcare insurance where they were nonprofit. They were, if you broke even. Supposedly, long ago, mutual insurance companies would pay back part of the premiums to the policyholders. I was never the benefit of that, and from reading accounts in the newspaper, the recent payback to policyholders certainly didn't match the increase in premium that they got afterwards. So I would just say, why not we control their profit, or maybe get more competition? But the reality is, more competition certainly is not going to lower the premiums. As long as business people are running it, it's not their only issue is the bottom line. How do they make the most money?
All right.
Somehow or another, too, I would have to think that recently I had to pay out of pocket for myself, and I took a couple employees to minor emergency centers and paid out of pocket. And each time I asked if I could pay what the insurance companies were paying, and she said, "Well, the last one just recently, the clerk said, well, you pay the copay." I'm like, I understand that I pay the copay, but I'd also like to pay what the insurance companies would reimburse you. Mm-hmm. And she says, just stared at me like I had two heads. I'm like, all I'm saying is that I should pay, I as an individual should pay the same amount that the insurance company reimburses you for. And all she did was stare at me.
All right. Mm-hmm.
And none of the vast majority of the doctors that I've had to see, since I have no insurance, since I can't afford insurance any longer, they're not willing to give me the same rate that they would give the insurance company, and that's extremely unfair.
All right, cool. Great interview. Let me